What's the difference between SI joint pain and sciatica? The two things actually are very different. However, it's actually been butchered throughout time via just general conversation from people. Typically, what will happen is people say, my sciatic, or my sciatica, and they'll talk about their buttocks area. This is actually not what sciatica is. It is a region that the sciatic nerve passes through, but that is not the clinical diagnosis of sciatica. Technically, SI joint pain and sciatica are different things, although the area that you're probably talking about is actually in here. So, sciatica is distribution of pain down the leg past the knee. And it's usually in a string-like format. It can make the hamstring tight, it can make the calf tight, it can make the foot numb, all these things. It can make it so you can't bend forward whatsoever before just lightning will shoot down your leg. That's sciatica, all right? Pain into this area is not necessarily sciatica, but it could be related to an SI joint dysfunction or even a nerve root irritation or even a disc problem, all right? Typically, the nerve root irritation will go down the leg as well, but it can refer just into this area too. So the SI joint itself is just this joint right here, which is kind of floppy, okay? It's this area right there. And so what we're looking at with this is typically when we look at people with SI joint dysfunction and figuring out if it's the reason for their pain into their area here, then we're looking at, is the area too tight or is it too loose? If it's too loose, we suggest things to tighten it up. And it's not always surgical, by the way. It's not injections. It's typically things like exercise, corrective exercise, specific ones that are like medications to improve the function of the area. If it's too tight or fixated, we'll recommend some mobilizations of it. I'm Sebastian from Performance Place Sports Care in Huntington Beach. We do our very best to guide people to the best information possible about SI joint problems, as well as the ways you can solve problems within this area. We're very good at this area, and into this area. So please reach out, ask us any questions you can. We've been doing a very big push to try to improve our ability to speak with you guys, even if you're not living in the area. So a lot of clinics will only talk to you if you're only in the immediate area. We're doing our very best to actually expand this. So if you're living in the middle of nowhere and you have no one to help, we're going to help you get to the right solution. So reach out to us. We do virtual stuff as well. Feel free to share this, like it, and subscribe. See you soon.